morning, and thank you for joining us today. We are gathered here today on the traditional territory of the signatories of Treaty 7, and I'd like to acknowledge the Métis people of Alberta who share a deep connection and history with this land. My name is Kathleen Ganley, and I am the Alberta NDP candidate for Calgary Mountain View. I'm joined here today by Calgary Glenmore candidate Najwan Al-Junaid, Calgary Acadia candidate Diana Batten, Calgary Cross candidate Gurinder Singh Gill, Calgary Klein candidate Lizette Tejada, Calgary Beddington candidate Amanda Chapman. We come forward today as candidates and as parents, healthcare workers, and community advocates. Albertans know that Danielle Smith wants to make you pay to see a family doctor. She said so herself multiple times. In one interview, she said she wanted to, quote, get Albertans used to paying for their health care. In another interview, she said Albertans should develop a, quote, payment relationship with their doctors. She even said coverage of doctor checkups under Medicare was an error. These are her words. These are extreme views, and they are part of a defined pattern of extreme views held by Danielle Smith. Earlier this week, a video emerged in which she compared the vast majority of Albertans who were vaccinated against COVID-19 to followers of Adolf Hitler. She said she would no longer wear a poppy because of the public health measures. Today, I'm going to show you another video, one we believe all Albertans should see. Not only does Danielle Smith want you to pay to see a doctor, and not only does Danielle Smith believe the majority of Albertans are comparable to followers of Hitler, she also wants to sell off Alberta hospitals. I will now play the video and then comment further.
Programs or any hospitals themselves. No matter how much money we pour into the funnel at the top of Alberta Health Services, none of it is going to get down to the front line. It's because we have Alberta Health Services receives the money, and then Alberta Health Services contracts with themselves to spend the money. And then we ask Alberta Health Services to evaluate their own performance and say, how you're doing. And guess what they say? We're doing fantastic. Now think about splitting these roles. You give money to Alberta Health Insurance. It's a separate entity. It's a government entity, so it's publicly administered. They are forbidden from running any programs or any hospitals themselves. Alberta Health Services becomes the contractor. Sure, we can grandfather in their contracts for now, but then we would have the Alberta Health Quality Council do us an auditor function and tell us whether or not Alberta Health Services should continue running the Lougheed Hospital, or the Rocky View Hospital, or South Campus, or any of the 100 hospitals that they currently run in majority in the province. And if they can't meet the terms that we want them to, we can do an RFP. And then the Alberta Health Insurance can give a different contract to a different group of doctors and a different group of patients and a different entity to run all of our hospitals. That is completely compliant with the Canada Health Act. It's a structure issue. And it's a political will issue. And we've got neither of those, unfortunately, because I presented this to the health minister and they did not act on it. This is why no matter.
There you have it. Danielle Smith thinks she can sneak around the Canada Health Act to sell off our hospitals to private individuals and corporations. She even names a few on her list: the Rocky View, the Lougheed, the South Health Campus, and as Smith herself puts it, the other 100 public hospitals in our province. This speech from Smith was delivered at an event called Freedom Talk in October of 2021. Freedom Talk was hosted by a man named Danny Hozak, who was disqualified for running from the UCP in 2019 because of offensive social media posts. Hozak compared judge-ordered publication ban to Nazi-level censorship. Hozak said that Europe needed to be saved from Islam. These are the people Danielle Smith surrounds herself with, people she would fight to get out of jail, extremists, people who don't put the priorities of everyday Albertans first, people who are dead set on dismantling our public healthcare system. Danielle Smith cannot be trusted with our public health care. Albertans deserve better. We stand here to promise you, with an Alberta NDP government led by Rachel Notley, if you need a doctor, you will get to see a doctor free of charge. The only card you'll ever need to access health care is your health card. That's our commitment to you, a government you can trust to put your family first. Thank you, and I'm happy to take your questions.
All right, thank you, Kathleen. Just a reminder for those joining us on the phone to use the *9 function, and those for joining us on Zoom to use the raise hand function to get into the question queue. We'll first start with any questions in the room.
I think our leader has been clear that we won't be taking your questions until you issue an apology to my colleague.
If you are elected government, would you continue to not talk to members of the Alberta Press Gallery?
And we'll go to questions on the phone. So the first question coming from Times of Asia. Go ahead, your line is open.
From Times of Asia, my question is, how many more videos Alberta NDP has?
Well, I think, these aren't our videos. They're coming from, I certainly personally wasn't at this conference. I think these are just videos taken of Smith over the course of her career, whether previously in politics, whether in media, even as premier. This one is from an event called Freedom Talk in 2021. What I do think is that Albertans deserve to know who they are electing. Danielle Smith might want to hide her views. She doesn't want to talk about her policies. She doesn't want to talk about a $20 billion corporate handout. She doesn't want to talk about taking us out of CPP until after the election is over. But, an election is about values, and I think that, Danielle Smith here is clearly demonstrating that her values don't include public health care. And so I think that Albertans deserve to know that.
Do you have a follow-up?
Yes, I do have a follow-up. So, what does Alberta NDP have to say Albertans about these comments coming nearly on daily basis from the United Conservative Party?
I think they're incredibly troubling. I think they state very clearly Danielle Smith's view. She has referred to unvaccinated as the most discriminated against group in history. She didn't take that back, even after people pointed out that there have been, genocides throughout the world and even here in our own country. She obviously, continues to compare Albertans who got vaccinated to Nazis. That's extremely problematic. We've seen multiple instances come out where she has attacked our public health care, where she has talked about why it's good to have to pay for a visit to a family doctor, where she's talked about why it's good to sell off our hospitals to private companies. So I think that these are clear demonstrations of her values, and ultimately she will govern based on those values. And I think that Albertans deserve to know that, because these are not the values of Albertans.
And our next question comes from Jason Herring at the Calgary Herald. Go ahead, Jason, your line is open.
Howdy. All right, Danielle Smith has talked a few times now about how EMS response has markedly improved since she became premier. I looked at some Alberta health data, and that does bear out. Interested in your thoughts on that and what actions your party would take with regards to EMS if elected.
I would have to say that's certainly not what I'm hearing from folks on the ground. I hear from Albertans every day, from constituents, parents, from healthcare workers themselves, and they're not indicating that the crisis is over. They are not indicating that everything is solved. We've seen this happen from the UCP, 3 or 4 times now? It seems like every month they come out and say, we've solved the crisis in healthcare, the problem is over. And then, we see red alerts on ambulances. We see wait times at hospitals ballooning. We see parents waiting with their kids for 15 hours at the children's hospital. So, I don't think that the crisis is over. That's certainly not what I'm hearing from people who are using the healthcare system or people who are working in the healthcare system. And I think the UCP would do well to take this a lot more seriously. In terms of Alberta's NDP, I think we've made some commitments. We have committed to undertake the largest healthcare recruitment in history. I certainly think it starts with not attacking healthcare workers, not threatening to lay off nurses at the end of a pandemic, not attacking family care physicians, because that's how you attract healthcare workers to work in your province, is by not picking fights with them. We've also put forward our policy on family health teams. That will ensure that 1 million more Albertans have access to a family doctor within 48 hours. That'll take a lot of pressure off the acute care system, because those people will be getting care in the right place. So I think we've come forward with a lot of ideas, and we will come forward with more.
Do you have a follow-up, Jason?
Yeah, unrelated follow-up. The UCP this morning released some letters it sent to Elections Alberta alleging that 3 unions are running illegal third-party advertising campaigns on behalf of the NDP, calling for an investigation into that. Looking for your party's response to that.
What I would say is this. The Alberta NDP certainly stands with working people. We do have a Labour caucus. We also have a women's caucus. We also have a race equity caucus. We take great care to ensure that everyone has a voice at the table and that all Albertans are represented. We are not engaged in any illegal activity. We are simply standing up for working people. And if we want to start talking about who's friends with whom, you're talking about a premier who literally went out of her way to try to assist someone who was criminally charged and ultimately convicted of, attempting violence against police, of blockading a border. This is highly problematic. She associates with extremists. She associates with racists. So if this is going to be an election fought on who stands up for who, we will stand up for women. We will stand up for racialized folks. We will stand up for Labour. And she's going to stand up for extremists. I think the majority of Albertans are going to agree with us on that.
Our next question goes to Catherine Gagowski from Alberta Today. Go ahead, Catherine. Your line is open.
Thanks for taking my question. So in Alberta right now, we have hospitals that are managed not only by Alberta Health Services, but by Covenant Health. And I believe the Canada Health Act allows for private hospitals so long as the services there are publicly insured. So how would, say, something that's run by another entity such as Covenant Health be wrong? What's wrong about it?
So we don't presently have another public service provider in the province. So this is, clearly a conversation about private service providers. She specifically said, another group of doctors or another group of individuals. She also very problematically said another group of patients, suggesting that, as is the case with many sort of private healthcare providers, these folks will be able to pick and choose the least complicated patients with the least complicated cases, and that puts a lot of pressure on our public system. I think we can look south of the border and we can see fairly clearly what the results of this sort of healthcare are. They're incredibly problematic. What it means is you wind up with the private system generating a profit by taking on less complicated cases and less complicated patients. Meanwhile, you wind up with a public system that's overburdened, and so people don't get the health care they need or deserve. They get the health care they can afford. And that, we have very clear evidence south of the border of the problems with that. We even have evidence here. They've sold off our laboratory services, and I hear every day from people who are waiting weeks to get their lab appointments. So I think it's incredibly problematic, and I think we have a fairly demonstrated history of why it's problematic.
Do you have a follow-up, Catherine?
And I guess one thing that the UCP frequently bring up whenever this question is raised is the fact that we have had chartered surgical facilities for decades. You brought up the labs being sold off from private to, or from public to private. So would you republicize those labs? Would you wind down the chartered surgical facilities? Or, because I think what I've heard before is that you're going to continue with them as long as it makes fiscal sense.
So I think in terms of what we have now, what we're looking for is stability in the system. So were we to be elected, we would want to sort of maintain that stability, because right now the healthcare system is in extreme crisis. And I think right now the best thing any government can do is make sure that we're maintaining the services we have. We're trying to increase and improve those services as much as possible so that we can, get the crisis we're in dealt with. And that will probably take a while. The UCP drove a lot of physicians and a lot of healthcare professionals out of the province. It is going to take a while to fix that. In terms of moving to increased privatization, I think we can see with lab services what's happening with respect to that. That's definitely not a move that the NDP would make. And I think we can look south of the border and we can see what happens if you start allowing facilities to, take on medically necessary cases like this and to pick and choose which patients they get. Now, bear in mind, when she spoke, she's talking about privatizing 3 out of 4 hospitals here in Calgary. That would only leave one public hospital to take on the majority of cases. And then, so you have people potentially having to travel a really long way, spending time in an ambulance because maybe the private hospital won't take them. I think that's incredibly problematic. I think we see it all the time in the US, and I think Albertans have a right to be worried about it.
Our next question goes to Mandeep Pujara at Prime Asia. Go ahead, Mandeep. Your line is open.
Hi, Mandeep, this side from Prime Asia TV. My question is, what plan do you have to deal with this kind of situation as we are in a pain like players waiting for a long time for the surgeries in Alberta, and they have already outsourced few of the surgeries to the private players in Edmonton and Calgary. And how does Alberta NDP plans to counter UCP's leader plan to privatize healthcare and sell hospitals in Alberta?
So I think the best way, I'll start with the last one first. I think the best way to counter the UCP's plan to sell and privatize hospitals in Alberta is to tell Albertans about it. Danielle Smith, again, wants to avoid having these conversations during the election. She has all these sort of controversial plans around selling hospitals, around making you pay for a doctor, around taking us out of CPP, giving $20 billion away to companies to clean up their own mess, creating her own police force. And she's explicitly said, well, I don't want to talk about those until after the election's over. Well, I think Albertans have a right to know. That's the point of an election. They have a right to understand what they're getting and to choose freely. I think in terms of what Alberta's NDP would do about the surgery backlog, you're right, the surgery backlog is getting worse. It has certainly gotten worse under the UCP. Our plan starts with our family health teams. What that means is that more Albertans get access to a family doctor more quickly. They get more care in the family health care sphere. There's an enormous amount of evidence that getting people better access to family health care reduces the burden on the acute care system. So that's the first thing. You have fewer people coming into the acute care system because they get healthier sooner. The other thing we're talking about is undertaking the largest healthcare recruitment in history. So that's going to help a lot. We will work with universities to ensure that we are training more healthcare professionals because we know we need them. But I think there are a lot of, nurses or doctors who have left the province or who have left their professions that I have spoken to, and they did that because of the UCP. They did that because, they were attacked at the beginning of a pandemic. They did that because they were called names. And so, we'll start by welcoming those folks back.
Do you have a follow-up, Mandeep?
Pardon me.
Yes. Do you have any plan for the immigrants coming here with a big experience and a medical educational background here, be actually not using their expertise to get answer and the solutions for these kind of problems? So do you have anything specifically related to get a benefit from their medical education and the experience they are getting and they're taking to Alberta?
Yeah, absolutely. So that is one of the ways that we increase access to healthcare, is by ensuring that Albertans who do have these credentials that are coming internationally have a clear path through. Our leader and my colleague Irfan Sabir have been very clear about our plans to ensure that people have a path to have their credentials recognized. Excuse me.
And we have time for one more, so we'll go to Michael Rodriguez with Calgary Herald. Go ahead, Michael. Your line is open. Michael, you'll just have to unmute.
Hi, sorry. This question's for Kathleen. I'm hoping that you, as a lawyer and the former Justice Minister, can offer some thoughts on the UCP's safety plan, specifically the pledge to slap ankle bracelets on violent repeat offenders on bail.
Excuse me. Yes, absolutely. So this was certainly something that came forward as an idea when we were in government. At the time, you know, the department had done a lot of research, and there was a lot of research, and those programs weren't working well. The suggestion was that at some point the technology would come along far enough that it would be more useful. And I don't know for certain whether that point has been reached yet. It's certainly something we'd be willing to look at. But I think, you know, there are demonstrated strategies in terms of how to reduce offenses when out on bail. They involve training with correctional officers. They involve implementation of certain specific programs and management tools. And I think the evidence at the time was that those things were much more cost effective and much more effective in terms of preventing recidivism, whether when out on, reoffending, whether when out on bail or whether, you know, after released. So I think that the UCP should be looking at the evidence, and they should be doing the thing that is most important first. I think that suggesting that this technology will just be a solve, it's just not correct. You know, they tried this in the UK, they've tried this in several other places, and it hasn't been particularly effective. It has cost an enormous amount of money, and it hasn't increased public safety at all.
Do you have a follow-up, Michael?
Yeah. Does the NDP have any specific plans in reducing recidivism among repeat offenders? Sorry.
Yeah, absolutely. So we have released a public safety plan as well. It involves 150 new officers. It also involves 150 new sort of paired mental health professionals, whether social workers or otherwise, to go with those individuals. In a lot of cases, preventing recidivism is about knowing your offender and what it is you need to do. Now, some people, you need to build a case to ensure that they stay in jail for longer. Other people, you need to ensure that they get into an appropriate treatment program, and that includes all sorts of treatment programs, not just the abstinence-only program that the UCP is pushing. It includes all sorts of things. Also, affordable housing. I think if you ask most of our police chiefs throughout the province, they will tell you the same thing, that affordable housing is the most likely thing to increase public safety. The UCP have consistently cut affordable housing. They have made virtually no investments over the course of their time in government. And we see the effects of that every day as we walk around in our communities. So definitely those investments in affordable housing, increasing policing, but pairing it with social workers so that we're ensuring that we're getting people, you know, not just spinning through the justice system, but on the right track to increase public safety. All of these things are backed by an enormous amount of evidence. And I think we would take very seriously the fact that every Albertan has a right to walk down their street with their children and feel safe.
And that's all the time we have today. Thanks, folks.
Can I ask a